global approach to health is using the three major themes of the conference, which is diversity, accessibility, and sustainability. So, first of all, we need to remember we live in a unique global situation. We are all connected instantly. We can access any information instantly, and there's thousands of modalities and treatments available. So the challenge is more how do we select and how do we combine and the timing and order of the treatment. So the idea is to maximize health. So my experience shows that global health is actually a teamwork. It's very important to leverage the diversity of expertise and the resources to really address the complex health challenges we have in the world today and the rising of chronic illnesses. So I'm not just talking about practitioner, like a team of practitioner as a team, but also engaging the patient and the practitioners very actively. So the patient is part of the team. And we need to combine knowledge and innovation. Our interconnected world allow us to share this knowing and innovate together, and that way we can make significant strides in public health. So the goal is to really improve global health outcome by working with the complexity of human being and addressing also the toxicity we are exposed to in the world. And so teamwork improves that health outcome for everybody. So it's also looking at the global aspect of the person, which is involved the physical body and the environment the physical body is in, which is very challenging at the moment. The mental body of the person, the emotional and social interrelational aspect of that person, and of course the spiritual aspect, which is included in most traditional approaches. From my experience, there's three basic underlying causes of disease. Major one is overload of toxins. So particularly in our world today, we are exposed to toxin and toxicants, which is man-made toxins, at every level. In the air we breathe, through chemtrails, in the water with fluoride and the heavy metals. We have glyphosates in most food. We have chemicals in every product. We're really surrounded by toxicants. So we need to be very aware and help the person detox, as well as internal toxicity, which will be, negative thoughts or heavy emotions that the person cannot process. That makes a lot of inflammation in the body and can lead to any disease depending their weak spot. In the West, we are very overweight. In the average population is slightly overweight or majorly overweight, but at the same time they are undernourished, and so the body doesn't have the proper equipment to actually heal and stay well. And there's also a major imbalance of rest versus movement. We are very sedentary, so we don't move enough, and also when we rest, we're not resting properly. So all these major causes of the beginning of disease. And disease is not the enemy. It is a signal that we have strayed from what supports life, and there are interferences to our body's natural ability to heal. So this is a very different perspective on what disease is. And so we just need to support that ability to heal and remove interferences. So let's look at diversity as the first theme. So diversity will include treatments incorporating various cultural and medical practices in an appropriate way. And so it's a very strong dynamic interaction to combine this therapy for best outcome for the patient. And so staying with that global perspective and respecting and integrating that worldwide knowledge. So health is not a magical pill. You don't swallow a pill and be healthy. It's a very highly personalized treatment We need to consider the complexity and the multi-level patient condition. It's a holistic design. It integrates physical, mental, and social aspects. And of course, the patient has to be engaged for successful health outcome because statistics shows that about 80% of chronic illnesses are actually coming from lifestyles and everything the patient is doing. So as practitioners, we need to be encouraged to understand how different modalities work together, how they can complement each other, and how to foster connections and networking amongst ourselves that we can, for the benefit of the patient. So on the outer diversity is the teamwork, which is crucial right now because it allows for the selection of very suitable and compatible treatments that still address the whole person. And we can use tools like dowsing or radiesthesia for muscle testing, or sometimes specific devices that are now created where the practitioner can find the most beneficial combination and timing of treatments. So this collaborative approach really ensures that different modalities work together effectively, leading to, again, optimal results. And of course, it helps foster connections and networking amongst practitioners, which again enhances our understanding of how everything works and how complement each other. So it's a very powerful integrated approach for achieving a high level of wellness and then restoring balance and optimal functioning in that person. Now, in my 3 or 4 decades of practice, anybody who has fully recovered from a serious degenerative condition has made the following changes. They change their lifestyle. They detox their body and mind. They are 100% engaged into healing. They live from their authentic self. They address the emotional root cause of the condition. And then they, of course, can add any supportive treatment. But sometimes there's no treatment needed. When they do all this, the condition reverses. So the treatment is beneficial, of course, and supports, yet it is a secondary. The internal changes the patient makes are actually primary in the recovery. So now if we look at the diversity from an inner perspective, we need to encourage more inner exploration. It's not very supportive in a lot of therapies in right now, but we need to start incorporating the person energy and how that system talks to them. So listening to the body, like very often the symptom is a metaphor for what's happening in the life. I had a patient who was referred to me for acupuncture to treat her arthritis in her right knee. But when she came and we assessed her condition, look at the history and everything, it didn't make much sense. So we checked what was going on when this knee problem occurred, which was 3 months before. And that was a time when she was trying to step forward into her life into a new career. She was leaving a very lucrative professorship in the university to engage into a drama kind of career. And so her system locked in the knee because she had doubts and anxiety about it. So the whole session was actually to clear within herself and help her reconnect with her true, authentic self with no more doubt, no more fear, without any physical treatment. And then within 2 days, the knee was about 50% better. And within a week, it was completely cleared without any form of physical treatment, because in that case was a classic metaphor from disturbance in the psycho-emotional level. Often it's a message to change something if the body doesn't give symptom for no reason. So that's very important to remember. Very often it's a reminder to process an older issue. Like if people start getting anxious or emotionally disturbed, but they don't really connect it to anything that's going on in the present moment. It could be the system trying to remind them to process an older trauma. So we need to check what the energy is around that symptom. And almost 100% of the cases in chronic illnesses, there's always a trapped emotion, which is like an emotional traumatic situation, where the person never processed that properly. So it's still trapped in the system and causing a lot of inflammation and pain. So we need to learn and to help the person listen to understand the message of the body. Now, when we look at accessibility of information or treatment through the web, it's basically limitless. So we need to start leveraging telehealth to access practitioners worldwide. So because sometimes it's very important to get a second opinion and with an expert somewhere in the world. So also, of course, artificial intelligence has this extraordinary capacity to supply accurate information and perform different tests and different things. So it's like, it's just amazing. And also, energy work virtually is very suitable for chronic conditions that need ongoing support and clearing these traumatic interferences that often they are the deeper cause of the condition. And this can be done anywhere because this can be virtual. Again, we need to encourage the inner accessibility, the inner connection to that person, inner wisdom. Healing comes from within, and it has a lot to do with personal transformation. It's a journey. It's not just something you do. It's just an ongoing journey. And it's very strongly linked to personal growth. So that's why introspection, meditation, exploration of the symptom, pondering on what's really happening in the body, asking questions, being curious is extraordinarily powerful for the person. So, like, for instance, questions like, when did I start feeling that pain, that discomfort, that emotion, right? What was happening then? I had a beautiful 26-year-old Italian patient who came in with severe ulcerative colitis. And she had that for 10 years. And no matter what dose they gave the medication, she was getting worse and worse. And when we asked these questions, so in her case, it was 10 years ago. So when she was 16, when I asked what was going on then, she burst into tears. And she had this massive guilt in her system about having contributed to her grandmother's death. And because she had an argument the night before, and the next day the grandmother suicided. So she took it all personally and had this massive guilt that was eating her large intestines. So after we reassessed the whole situation, she looked at all aspects of that and she realized there was nothing to do with her argument because the grandmother usually argued with everybody. And it had a lot to do with the fact that the grandmother was going to go into a nursing home because she was losing control of her bowels and urination. So that was an extraordinary case, but that shows like it's so important to attend to what's behind that illness. So in her case, the energy was massive guilt, right, behind the symptom. So we need to understand, the person has to understand what is my body, which is basically the subconscious mind trying to speak to you. And then what is really interfering with the natural healing process. So once you clear that, then they respond to the medication and then they start healing. Now, when we look at sustainability of long-term results, then obviously health has to be a primary value in the person. If they don't care about the health and it's not a primary value, they're not going to sustain the results. So that's a major thing to establish. Then, of course, education is a major component of the healing process, to educate the person about their body-mind system, about that everything is interconnected and how emotional mind impact the physiology. So that is one way of engaging the person so they start having more agency and taking action towards their health. So that encourages them to take more responsibility for their health because they will have to change something in their life, either their lifestyle or their mind style or clear the emotion or whatever it is that they need to restore the balance. So, in fact, it's extremely empowering when they start practicing the skills that they learn with us and starting taking charge of their health. So, long-term sustainability will have these five components. And I thought like group sessions, whether they're live or online, are extremely supportive of keeping the person practicing the skills and getting interesting feedback from other patients who have, maybe similar condition or have gone through different experiences that they, when they share. So they learn and that is very powerful to sustain the momentum of them keeping working on their health and practicing. So there could be groups of meditation, there could be breath work, there could be a qigong yoga, there could be just group where they share what's happening with them and how they got better and how, what's the challenge and how they overcome that. So these are very powerful for sustaining that momentum of health. And of course, we need to start moving beyond just relieving symptoms, finding the cause, to now starting designing a lifestyle for long-term health and longevity. So again, it will start primarily with awareness, becoming aware of themselves and where they depart from the balance, and then living really from the authentic self so the body can function optimally. They need to trust intuition, checking the mind state. Healing has have a lot to do with every decision you make in your life. Every decision will actually move you towards healing or away from it. Okay. So, as we mentioned, we need to release traumas, unbeneficial belief. They need to shift their perspective about how they perceive their body. A lot of people don't like their body when they're in pain, right? They're saying something is going wrong, but actually this is the body talking back to them and letting them know something needs to change. So they need to perceive the body as, an amazing bio device that has the potential to heal anything. And if it does show a symptom, there is a major reason. And looking into it and processing that. So asking questions and not being afraid of the symptom, but connecting with the symptom. So from that, they will learn from that past experience. They become more adaptable. And then once they are, comfortable and balanced, then maintaining longevity, intermittent fasting is extremely powerful. They did a lot of tests on rats as well as people, and all the time it shows that it prolongs life and the quality of life. So also like the quality of food, the timing of food, and then how to restrict food at different times. One of my Chinese teachers said that you eat anything for 5 days, and then for 2 days, very very light, right? Or sometimes you can do one day just on liquid, right? So you give a rest to the body, and then the system resets. So, of course, in our society, we need to really keep in mind that we need to detox physically, mentally, and emotionally. But physically, a lot because we have this constant exposure to toxin. And then, of course, involving regular movement, movement that needs to be enjoyable. It's no point going to do an exercise that you can't stand or you hate it because then it won't make any difference. And then connecting with nature. Nature, we are nature, and just being in nature is extremely healing. Sunlight is very healing, not just with the vitamin D hormone, but all sorts of processes in the body that are actually optimized when we are in sunlight. So meditation, having more peace of mind, right? Practicing things that bring joy, being grateful is extremely healing, right? A sense of appreciation changes the chemistry instantly. Um, you may be aware of the Heart Math Institute. They've been doing research for 15 to 20 years on the power of the heart and the heart-brain connection, and it's just extraordinary. So keeping the person being appreciative of the body does everything to keep them alive at all times. So appreciating that, working with the body and being grateful is very, very powerful. And then making sure they rest properly. They might need to rest physically, mentally, emotionally, having creative rest, having spiritual rest, right? Which level is most needed for them. Hopefully have minimizing the Wi-Fi exposure, which is extremely toxic, and then, stimulating that restorative process. And then looking at environment, social interactions that are, again, can support them into health or move them away from health. And there's an amazing concept called homeostasis. Homeostasis is actually designed to increase resilience in the body. So homeostasis is basically putting the body through a very tiny, small stress level for a very short time, but it actually challenges the body in a very healthy way. So, for instance, holding your breath for 20 to 40 seconds, right? Maybe standing on one leg for 2 minutes, right? Having a cold shower, this kind of thing, like small stresses, but uh, enough to just wake the body up to see like, oh, okay, we might just optimize that section because just in case. So very, very interesting process. And then, of course, spiritual purpose, like helping the person trust and flow with life and stop resisting what's coming, because suffering is actually coming from resisting what is in the life, right? So all this as a long-term longevity process. This is just a simple diagram that I extracted from my book to show from my experience the four basic step of the cycle of health that needs to be, more or less a continuous kind of cycle. Because firstly, first level, you need to be mindful, awareness, being curious, like if I feel tired today and I was not tired yesterday, so what did I do? What happened? Where was I? What did I eat? Was I worried about something? What made the change? So being curious and aware of what's going on and then managing that to restore balance, right? So to restore that flow, then this is where you take action. So action means we need to release something, we need to recharge, we need to reconnect with something. So this is the usually when they come to see us as practitioners to help them if they are not quite sure what to do. So once they're balanced and go back to normal, then now how do they maintain that optimal functioning? So this is when they're supposed to apply the new skills or new approach to lifestyle, eating, doing things, and then as they do that, they will maintain that health, right? That well-being. And now, if they do that, then they get to the point where they experience very high level of wellness in all contexts of their life, not just physical health or mental health, but they will have healthier relationships, healthier work connections, healthier every aspect. So they will live more in harmony within themselves and in relation to others in the world. So global health is a very dynamic process. Hopefully, the education will start from childhood and educate children about what is a real food versus junk, and then like it's okay to feel angry as and supporting them to process that. A doctor original translation is a teacher. So we need to really teach people to stay well, right, in the world. And so that will engage them into, looking after themselves and doing whatever is needed for that. And so that brings more consistency into that well-being, right? And sustaining the change and helping them experience different ways they can sustain their health using different therapy or different support as well if they need. And so as we go, then they have this inner power that is um, active now, and they're more responsible, they're more engaged, and they really take charge of their life. And so this is the ultimate preventive medicine, right? So again, health and well-being is to do with integration, right? To have that wholeness in all levels of our being to allow that balance, that flow, that brings that vitality. And at the same time, there's a deep peace of mind when the person is healthy, right? So let me share two cases of patients just to show you an example. Jo she designed her whole treatment and she selected her team. She had the breast degenerative condition. So she knew exactly why she was sick. She had a major traumatic event with her son. And so she was ready to work on that. So we did that with energetic medicine. She also decided to take one round of chemo. So because of that, then we tailor-made a visualization process to prevent any side effect from the chemo. And she had no side effects. And then I referred her to a traditional Chinese medicine person who used raw herbs prescription, which is they're more powerful. She also opted to do an organic diet. She also taught her an introspective energetic meditation that she used daily for at least an hour to two a day. And she voluntarily designed another level of sending blessing to every practitioner in her team that was helping her. And that was about 30 years ago. And she's still going. And I keep meeting her in different meetings and congress or conferences. And she recovered completely, fully. So that was a major interesting combination. And this is another case of a lady who had severe menstrual bleeding. She had this for 15 years by the time I saw her. And that had completely depleted her energy. And she also had severe menstrual pain due to she had a massive fibroid, the size of a grapefruit. So she was exhausted. And so she felt too weak to work with just natural modalities to shrink that fibroid. And she wanted more immediate relief. So the plan was to have energetic session first to clear that psycho-emotional trauma that she had before this happened. So we used thought field therapy, EFT technique. Then we strengthened her energy and blood for 2 months. So she'd be strong enough to undergo the surgery to remove the fibroid. So I was doing acupuncture and her, she also received homeopathy. And then we did some imagery work to optimize the surgery. And then after the surgery, we had 2 to 3 months support to help her recover fully. And that worked extremely well as well. So we really need to stay connected, to cooperate and coordinate our skills for the benefit of the patient. We are so complex. The world is so challenging that we need more than just one modality when someone is really chronically sick. So global health is integration. But also we need to make sure we integrate past, present, and future. We need to keep all these amazing traditional modalities like Ayurvedic, Chinese medicine, shamanic, whatever in the past the modalities were, because that keeps us remembering that we need to work holistically and that everything interconnects. So we need to keep that very firmly. And then we need to also tap into that present moment with the patient to help them with interoception and introspection to access that inner wisdom to support the treatment and the healing. And then now we have also extraordinary new technology using light and frequencies that are helping the body regenerate and restore very quickly. So we need to have that integration of all three. So it's very exciting. We have a great potential of having health by design through recognition and appreciation of holistic ancient traditions, and then reconnection with the body mind wisdom to guide us back to that balance from within. And then that rejuvenation technology, which using light, frequency, and stem cells activation, which is very promising. So all this actually supports the natural body wisdom. So we work with the body. So I'm going to leave you with the Arabian proverb, say that when you have health, you have 1,000 wishes, but when you don't, you have but one. So these are just some resources for you to explore, and I hope we stay connected. And I'd like to thank Magnus Conference for this invitation. Thank you so much for your attention.